In today's video, we're going over myotomal testing. Push, 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 push. Myotomal testing can be used as part of a battery of tests to diagnose radicular, low back pain, radiculopathy due to a potential disc herniation. The problem with these tests is that they're decent at figuring out if you have radiculopathy and potentially looking at which level there's an injury at, but the sensitivities and specificity, perfect. However, they're still the best we got in determining if you have radiculopathy and at which level that injury might be. Tawa et al. Have found that myotomal tests have a sensitivity of 0.13 to 0.62, so not great for ruling out radiculopathy. They also found a specificity of 0.52 to 0.96, so it actually has a decent specificity for ruling in the pathology. And we can basically see where the weakness is, and that sometimes correlates with the level of the disc injury that we have involved, right? It's pretty easy to assess. The first one we'll look at is going to be the L2 myotome. It's resisted hip flexion. So essentially, we're gonna have Jake sitting here, bring his knee up a little bit into the air, and then from here, push up nice and strong to let me push you down. Very good, and then relaxing. We're gonna check the other side. So go ahead and come up, and then don't let me push you down, nice and strong, fight, 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 fight. Good, and then relax. So, a couple things here. So for one, we're looking for a difference in strength left to right. Okay. Usually I go through all these tests with my hands. We know that when you do manual muscle tests with your hands, we're actually not that accurate, right? Or thinking that there's a bit of a strength difference side to side. I just go back with a handheld dynamometer and actually get a true number on this. This is important for a variety of reasons. For one, we're gonna make sure that someone's weakness is not progressing. So if visit 1, they've got decent strength, visit 2, it's terrible strength, that's not good. They need to go to the doctor at that point. The other piece is that if you do find a deficit over the course of time, want to make sure you're actually improving that strength. If you're not measuring, you have really no idea, right? So after the L2 myotome, we look at the L3 myotome, and we assess that via resisted knee extension. So right here, Jake, I'm gonna have you push against me, nice and strong, push, 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 and then relax. We do the same thing on the other side, push, 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 push. Good, and see if there's a difference between sides. Next one we can assess is going to be the L4 myotome, and this one's pretty easy because we're looking at resisted ankle dorsiflexion. The way I like to assess this is by walking on your heels. So we're gonna have Jake stand up right here, and we're gonna come up on our toes on both sides, take a few steps forward, and then go ahead and take a few steps backwards. Good, and then relaxing. So we wanna make sure there's no foot drop, so essentially, can your patient keep that toe up, or are they uncontrollably allowing that foot to boop, slap the floor with every single step? The next myotome we're looking at is going to be L5, and we can test resisted great toe extension. So literally, let's have you try to bring your toe towards your nose here. Don't let me press you down. Push, 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 push. And I just assess the other side. Go ahead and push nice and strong. Push, 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 and see if there's any differences between sides, right? Next myotome is going to be S1, resisted ankle plantar flexion. So let's have you stand up again, Jake. And then from here, all you're doing is going up onto your tippy toes, and then taking a few steps forward on the tippy toes. Don't let the heels drop, and then backwards, same thing. Very good. And just like with the heel drop situation or the foot drop situation, we want to make sure the heel is not dropping towards the floor side to side, and see if Jake perceives any weakness side to side. And the last one's going to be assessing the S2 myotome. And from here, just go ahead and pull against me. We're assessing resisted knee flexion, and we'll go on the other side and go ahead and pull back. Yep, and then take a breather. So largely, we're just looking to see if there's any difference side to side, specifically weakness on the involved side. And if we have a positive special test, that's going to say, hey, you may have some radicular low back pain associated with a specific myotome. So now you know how to assess myotomes. The problem is this is only a small part of your evaluation for lumbar radiculopathy and associated disc pathology. However, I've got a video for you right here that I want you to click on because it's going to give you a very comprehensive approach on how to diagnose these. So go ahead and click on that link, and I'll see you in the next video.